Happy Monday, everybody. It's Dr. Leslie Apgar and the fabulous Lauren Corselia, nurse practitioner, coming at you from Greenhouse Wellness. Happy Monday. Today is National Nurses Appreciation Day, which is the first day of the whole week in which we celebrate our nurses, culminating in Florence Nightingale's birthday on the 12th. Flo's birthday. So we wanted to give a shout out to our special nurses. Obviously, thank you, Lauren, for everything you do. We're going to talk about that in a second.
Yes.
And obviously to Suzanne, who's one of our nurses here at Greenhouse Wellness. We just love what you do. We love everything you're about. We would be nothing if not for our nurses. So we wanted to introduce you, the public, and our Greenhouse family to Lauren and give you a little bit of a history. So Lauren, you decided to be a nurse. What happened? What's your history?
I decided to go to nursing school halfway through college, and I love working with people. I love helping people. And so I went to Johns Hopkins for my undergrad, graduated in 2009, worked at the bedside for a few years, and then went back for my NP, mostly because I did a couple of things as a nurse. I worked a little bit in marketing, and I worked a little bit in hospice, palliative care, critical care in the ICU, and my heart was really with the patients. And I knew I wanted to stay kind of clinically focused. So I went back for my NP at University of Maryland. And I got my degree in primary care focus.
Right.
So, love helping my patients, love being clinically focused.
So there you are. And now you've created your own LLC.
Yes, I have my own company now, certifying patients for medical cannabis. And it has been so rewarding. I was nervous initially because I didn't know exactly what to expect from the Maryland cannabis community. I wasn't sure what types of patients I would be seeing, how legitimate everything was going to be, but in my primary care practice, I had a lot of patients asking me about cannabis, and then a lot of patients coming back and saying, I got my cannabis card, it has helped me, my benzodiazepine prescriptions were going down, my pain medication prescriptions were going down.
So cool.
It was really, really cool. People were saying, this has just been so transformative for me.
So what I would say, Lauren, is that now you're part of the solution versus being part of the problem.
I do
you
feel
and I
that
were
way.
the ones writing all these prescriptions for pharma. Okay.
Yeah.
So what was something that surprised you about certifying cannabis patients? What was one of the things that surprised you?
I thought I would be seeing a much younger population. I definitely thought I would be seeing a younger population, and I would say the average age of patients that I see is 50s to 60s,
and that's
early 60s.
Similar to what we see here in the dispensary.
Yeah,
okay.
And these people are really sick. I have MS patients, I have Parkinson's patients, I have cancer patients, I have seizure patients, I have a whole chronic pain is obviously huge.
Inflammation.
Yeah.
So a lot of our patients, even though this program has been out and rolling for a couple of years now, are still so confused about what the process is.
Yes. And the process is a little bit confusing because it's 2 steps. You have to register yourself with the MMCC, and then you have to see a certifying provider. And so the MMCC process can be a little bit daunting. You have to get your picture just right that you upload to their website. And then the process of finding a provider, a lot of people don't necessarily know who to go to. They want to go to their primary care, but sometimes their primary care can't do that for whatever reason, or their pain management doctor can't do that. And so I have really been... it's been awesome for me to be able to help people and guide people through the process and help them. And they're so appreciative. My patients are so appreciative of my help. And, just I've been navigating the process myself. I'm going through it with you guys.
Yeah.
So that's
down
what I
in the
was saying to
trenches.
people. Yeah, I'm down in the trenches with you. But we're figuring it out, and everybody's been great.
So let's talk about what the patient experience might be. So if a patient came to you to be certified, what would they need to know, and what would they need to have prepared to come and see you?
So I would say that the one process of registering yourself with the MMCC is huge. You need 4 basic things: your social security number, email address, a working email address, You need a copy, like an electronic copy of your driver's license front and back, and then you need a passport-sized photo with a white background. And it has to be just like a passport photo with your head and, you know, shoulders and that whole bit. So they have specifications for that. And then when they come to a provider, documentation on what your condition is. So if you have anxiety and you go see a therapist, have a therapist write a note about your anxiety. Or if you see your primary care about it and they're prescribing your Zoloft or your Lexapro or whatever the case may be, get a note from your primary care physician. If you have pain, get a note from your orthopedic.
If you have
Any
x-rays,
documentation.
don't bring the actual
X-rays.
films, guys. We don't have a light box, but
Don't have a light box, but just the reports saying, you know, what the condition is.
Right.
You know, I can read any X-ray report, MRI report, anything like that.
And then,
so
at the very least, you're interested, excuse me, in a medication list.
Yes.
What medication are you taking?
Yes.
How many milligrams? How many times a day? That's very helpful
Yep.
for you. Okay.
And then my visit, I just kind of go through, you know, a little systematic documentation for myself, you know, assessing what the problem is, how you've been treating it, is it working, is it not working, get some vital signs on you. So I do my own little assessment as well and create my own documentation.
We love it. So obviously at Greenhouse Wellness, we're so committed to bettering the whole industry. We want to, you know, keep it as authentic as possible, and we love associating ourselves with professionals like our nurses and our NPs. So thank you so much for being a part of this industry and making it better.
Absolutely.
We're happy to know you.
Yes, same.
And we're happy to know you too, Greenhouse family. We always, as always, just love your support. We're so grateful to have you. If you have any questions or any comments, just don't hesitate to shout us a little note, and we will get right back to you. We will see you guys next Monday.
Take care.
Bye-bye.